Good morning everyone. I am Dr. Robin Gupta, consultant neurosurgeon working at GM Hospitals. Today I'll be talking on important topic stroke. So what is stroke? Basically there are two types of strokes. One is ischemic stroke, which are the more commoner type, which is almost 85% of the patients, where there is a blockage in the blood flow which is going in the artery which is going to the brain, which leads to damage to the brain cells. Other type is hemorrhagic type, which is almost around 15% of the cases, where there is a bleeding in the brain that leads to brain damage. So any of the types, basically the patient, what will be the common presentation when the patient present with stroke is they will have weakness on one side of the body, whether it can be just a facial weakness or arm weakness or the leg weakness. It may be all three of them, basically arm with legs with hand weakness, and there could be speech difficulty. Patient may find not able to understand things, not able to comprehend what we are talking, not able to speak clearly what the person has to speak. And if you encounter any such symptoms in yourself or any of your relatives, then you need to basically consult the doctor immediately. So once you encounter such symptoms, remember fast. Is stroke reversible? Yes, definitely stroke is reversible. If it is treated within the window period, we can reverse the stroke. So what is the treatment of stroke? So when you encounter these symptoms, immediately first thing is rush to the hospitals. If the patient reaches to the hospital within the window period, that is within 4.5 hours of onset of these symptoms, we can give injections. Those are clot buster medicines, which is basically called as thrombolysis, by giving which we can dissolve the clot which is there in the artery, by which the blood flow to the brain can be restored, and again these symptoms which the patient has developed can reverse. Other option is thrombectomy, where the clot can be removed by putting a stent inside the artery and retrieving the clot. So that is called as mechanical thrombectomy. So that is done in the cath lab. As a patient or as a general person, what you need to know is, it's not that you have to wait for 4.5 hours or 6 hours to treat the stroke or to reverse the stroke. You need to remember is, as soon as you encounter anyone, any of your relative or you yourself developing any such symptoms, you just have to rush to the hospital, to the emergency immediately, because this is treated as early as possible. The more the chances that you will not have any weakness or any deficits in future. So basically once the patient reaches to the hospital, we'll shift how the patient is diagnosed is, first clinical diagnosis. We'll be assessing clinically what all symptoms you have presented with, whether it is really a stroke or a stroke mimic. Based on that, immediately the patient will be sent for a CT scan or a MRI. CT scan is usually to rule out whether there is any bleeding in the brain, which will be easily picked up in the CT scan. And if there is no bleeding, either if the center is having MRI, then immediately the patient is sent for the MRI. MRI will show the early signs of stroke. It will pick up the stroke very early.